out of the diner, I saw the stick-up going down, and I did what I could to help.
Mike, the waitress says you left the diner an hour and a half before she heard the shots.
Well, then that aspect of my time frame's out of whack.
Out of whack in the sense there's a big blank spot needs filling in.
Have it your way.
Hey, we got a perp and a civilian DOA.
Well, don't impugn me seeing a stick-up and coming to help out, Andy, out of whack time frame or not.
Get this rum out and some coffee.
I got some coffee for him. Get some coffee, Mike.
Come here. Give me your gun.
The particulars elude me. Do I want them to elude me? No.
All right, just drink that coffee and try to think out what happened.
So whores tricking out of those construction trailers.
Yeah, several of the diner patrons indicated that.
They'd probably know.
We were thinking probably when the shooting started, the hook is booked. Might be worth canvassing the strolls.
Yeah, good.
This is Walsh from the 2-7 squad. He's got his load on good, huh?
I got half an idea if I could remember it. He was out here doing the right thing.
Andy, Donnie Landers that I was in academy with, briefly partnered with this Walsh. So Donnie says he shows up for work one day. Walsh was intentionally standing naked in a locker room wastebasket. I mean, this guy really enjoyed his drinking. I mean, now, obviously, the drinking's become a problem.
Anyways, we'll do this canvas.
You okay?
I am okay.
Are you sure?
Morning.
Hey, that Mike Walsh?
Yeah, come on a stick-up while inside a Cutty Sark bottle. Best case, the perp kills a civilian and Walsh kills the perp.
These are the DOAs here?
Yeah, those would be the DOAs.
I'm Gary Tweedy. I own the diner here.
They recover the perp's weapon?
I'll show you the shell casings over here.
What do you know about this here, Mr. Tweedy? I want to correct my waitress Caroline's impression concerning Mike Walsh. Uh-huh.
Your refresher on novice detective work?
He's having so much trouble breathing, Andy.
Yeah, I know, I've been noticing.
No, it's getting worse and worse. This morning, he was having trouble putting his clothes on. I'm afraid to have him out here.
I've been noticing with this chest cold.
What I'm trying to get across, between the John and her smoking, Caroline will be off the service area 5-10 minute stretches. After leaving the restaurant before, when Caroline saw him go, Mike could very well have returned, saw this incident through the window, and gone back out to help.
Are you saying you saw him do that?
Saying it's very possible.
So this isn't so much a witness statement, huh? This is more like a friend giving a Mike Walsh character reference.
Oh, God. He can't stand up.
Better boy, Martinez!
Bobby, what's wrong?
I'm having trouble.
He may be having trouble breathing.
I'm gonna go get the car.
Yeah, I need to get looked at. Yeah. I need to get looked at.
Should we ride on a bus?
No. Let's just go in the car.
It's just this chest cold just knocked the wind out of you. Here, lean on me, put your weight on me.
What's going on? Are you okay, Bobby?
Yeah, it's just this chest cold.
Yeah, those are murder. Don't do no talking, Bobby. Just save your breath.
There you go. Transport Walsh to the squad.
Yeah, Jill's working a 4 to 12. Maybe the boss can have her come in early to take over our canvas.
Where you going, Andy?
You're going in with them.
Won't be more comfortable with you.
Shut up!
Can you lean forward again for me, please?
His results are printing out, and they got no doc yet to read them.
Come back.
When I tell you, take a deep breath and hold it.
If I could do that, I wouldn't be in here, man.
Do your best.
Ready?
Lean forward. This will be ready for the doctor to look at in just a few minutes.
There's an optimist.
Feeling more comfortable?
I'm okay.
Still no chest pain?
No pain. I'm just having trouble catching my breath.
Want this blanket over your feet?
No, I'm good, Andy.
You don't wanna?
Sure.
Hi, can you step back for a bit? Thanks. I'm Dr. Edson Robert. How's it going?
He's had a sublingual nitro. Here's his EKG.
CBC, cardiac enzymes, renal-lights. You found yourself short of breath.
Yeah.
He's been short of breath going on 10 days.
Okay. Your neck veins are a little distended. Can you lean forward for me? There you go. Take a deep breath. Again.
That's the last deep breath I got for you there, Doc.
Here you got moisturize at both bases.
What do you say?
Lasix, 80 IV, 2 of morphine, both IV push. We're going to clear some of the fluid out here in your lungs, Robert.
Call me Bobby, Doc.
Lasix is a diuretic. Clears fluid systemically. Morphine's to dilate veins, so less blood's going to the right side of your heart.
He's fighting off some chest colds at the root of it.
I'm having a heart attack here, Doc. What's up?
We worry about that with symptoms of shortness of breath, and you do have some subtle changes in your EKG, but I understand you don't have any chest pains, and essentially you've described symptoms you've had for 10 days.
I've been feeling winded for about a week now. Maybe a little more.
Have you felt crummy besides your shortness of breath? Muscle aches or coughing?
I've been coughing a little, yeah.
Did you bring anything up?
Not really.
Do you have heart disease in your immediate family?
No.
Sustain any wounds or injuries recently?
He got cut last week making an arrest.
Knife wound?
Carpet knife.
Clean, dirty?
Dirty.
How soon after you were cut did you get treatment?
Same day.
You come right to the hospital.
Did you smoke or drink heavily?
No.
High blood pressure or take medicine for any other illnesses?
No.
Use cocaine. Your answer will be kept in confidence.
Does he use cocaine?
No.
Use any other drugs intravenously?
That's it just now.
Teeth cleaned recently or other dental work?
He had his teeth cleaned about a week ago.
He had a dentist. They cut me right there.
All right. Can you excuse us for just a sec? I want to listen to Bobby's chest again.
Sure.
What do you think's wrong with him?
Let me look at his x-ray, and then I want to listen to Bobby's chest again. Maybe I'll have a better idea.
Don't go running off.
Wheelchair, please come to it.
Asks a million questions, gives you no idea of his thinking.
Your heart shadow's a little big on x-ray, Bobby.
Uh-huh.
And that doesn't surprise me because I hear a lot of pulmonary congestion.
So what do you think's going on?
You've got symptoms of heart failure, which doesn't mean your heart's stopping. It's just working inefficiently for the moment, and we need to figure out why.
Could it be a heart attack?
Your blood work will tell for sure, but I don't think you're having a heart attack. You need to be admitted so they can run some other tests.
Who's they?
You should be admitted to coronary care.
All right.
Who should I talk to about what's going on?
I think just my wife. You get my partner upset, he's liable to start putting his staff in the other beds there.
You want to come back in? Let's get a bed in CCU.
Oh, boy.
Mrs. Simone will be back to talk to you in just a second.
They don't need to keep me for a while, babe.
Okay.
Bobby has some fluid buildup in his lungs and enlargement of his heart, and that needs to be evaluated.
The doc says if I made him guess, you don't think it's a heart attack.
Do you have any idea what it is?
I really don't know at this point.
Could it be from the dentist?
It could be infection that migrated after dental work, or from the wound on his wrist, or from a whole range of other things.
And that would be treatable.
I'd certainly hope we'd be able to treat it.
So, maybe we should tell Andy to go back to the house.
They'll get you ready to go upstairs.
Thanks a lot.
You don't think it's a heart attack?
No, but they want to keep him a while.
So that's good anyway.
Yeah. He says Bobby's heart's enlarged.
Could that be a temporary malfunction?
That's what the doctor said. It can be an infection and they can treat it. I'll call when we get some news.
I'm gonna put you in room 5. The TV's on it, Fritz.
Okay, partner.
Hey, partner.
Here we go.
Keeping him in. It's something with his chest. Maybe it's a heart attack. They're not sure. Diane's with him. She's going to let us know. What's Walsh doing?
Declined a delegate. Won't give a statement except to you.
He's getting the shakes now. Pretty good, Andy.
What's up, Sipowicz?
Where do you keep your bottle?
What are you talking about?
I need a bottle for Walsh from the 2-7 squad. It's upstairs with the sheiks that I need a statement from.
Oh, you're looking to jam him up the way you did my guy that
No, but I'll jam you pretty good if you give me any trouble.
Okay, come with me to the John.
Is that the right thing, Andy?
The label's just a ruse. He gets 2 drinks. You'll be ready to talk in 5 minutes, Mike.
Have we heard from Diane how Bobby's doing?
No, nothing yet.
What'd you get off campus?
5 minutes after our shooting, a man was assaulted and his car was stolen on Henry Street, 3 blocks away.
Do you want to see who took him off?
No, his skull's caved in. He looks like he's going out of the picture. We followed a blood trail from the point where the car was jacked to within 80 feet of the diner lot.
So maybe the guy who stole the car is the second assailant and the stick-up Walsh interrupted.
Oh, did Walsh say anything about a second perp?
Walsh hadn't talked much yet about anything.
He needs to get his alcohol ratio in balance.
Oh. "15 squad. Oh, hi, sweetie. Hi. Did you come home for lunch with Emmett?
I'll tell you, Andy, I am absolutely more able to reconstruct this.
Well, that's not going to last, and you ain't getting more drinks, so let's get started.
All right. Chain of events. I see a struggle between a early 20s Hispanic and a middle-aged white male, maybe 100 feet away from me, near the diner.
Hey, are you ready to tell us a straight story where you were coming from?
100% candor, I was having a belt out the trunk of my car. I draw my weapon, I identify myself, running forward. Closer look, I realize this is a struggle over a gun. One shot, white guy drops, kid turns on me, I empty out into him. Spanish kid come up wrong on BCI?
$6 on a sheet. When are you going to tell me about the second perp?
We know there's a second perp.
Don't trifle with me, Walsh.
I tell you, I'm so relieved. I made a second guy an accomplice, and I threw some shots at him. But then I got so terrified that this was some pain-in-the-balls innocent bystander running for his life. How did we confirm that this was a second perp?
A blood trail from your crime scene goes around the corner to a same-time carjack assault. Now, give me a description of the second perp.
Well, it was dark. He looked around 5'8".
Was it a gangbanger or fresh off the boat?
It was dark. I just thank God that this was a bad guy.
You think I want a second perp, huh? I got a partner sick. I want this cleared. Now, you give me something on this second guy. A zit on his ass or something.
Maybe he had a ponytail.
Maybe he had a ponytail.
He was coming at me between 2 cars, about 50 feet away. He must have been a lookout. It was dark, but I am 80% on the ponytail. Your partner Simone is sick? 5'8", Hispanic with a ponytail.
Want to call your boss or your wife?
Oh, no, not at this point.
Okay. Yeah. Good. Do you want me to bring your wife in while we talk about this?
Please. Sure.
Come on.
How'd it go?
I'm about to tell your husband what I see. Your echocardiogram shows the same heart enlargement the X-ray picked up downstairs. Now, with the echo, we can also measure what's called your ejection fraction, which is how your heart's actually pumping blood. And that's lower than normal.
Is it a heart attack?
Your first enzyme tests have come back a little elevated, so we can't rule that out. But your other symptoms don't really point to an infarct. You're running a degree of temp. You're a little anemic, and you've got some minor elevation of your white count. Now, putting that with what your echo shows makes me feel you've got some kind of infectious or inflammatory process in your heart, which is giving you the symptoms.
So what do you do about that?
If this is an infection, over the next 12 to 72 hours, the extra bloods we've drawn may help us pinpoint what we're dealing with.
And then you'd know how to treat it?
With an infection that responds to antibiotics, you'd be looking at a complete recovery.
That'd be so wonderful.
So I guess you need me here while you wait on those results.
Yeah. I don't want to release you. We'll have to run a second enzyme series to absolutely rule out an MI. And we'll need to run some other tests as well.
What would be the earliest my husband could come home?
Till we're sure what we're dealing with, I'm really not comfortable giving you a time frame.
I understand.
Best case, 3 or 4 days.
That's not too bad. For you to walk out with a complete recovery.
Start breathing again. I'll definitely settle for that.
We'll have your second enzyme series later this afternoon, and that may speak more definitively on the heart attack.
But that's not what you think this is.
Right now, if you held a gun in my head and made me guess, I'd say no. The meds should get you stable and a little more comfortable over the next while. Now, let the nurse know if you're having any problem and she'll come get me. Otherwise, I'll see you in a few hours.
Okay. Thanks a lot, Doc.
Sure.
He seems like a nice guy.
Really nice. He didn't talk down at all. I mean, he sounds really optimistic.
Once I figure out what this bug is.
I wish you didn't have to stay here, but for a complete recovery, I guess 3 or 4 days isn't such a sacrifice. Should I call the squad and let them know it's not a heart attack?
Diane.
Or he doesn't think it's a heart attack?
Let's hold off until these next tests, okay?
Okay.
You know, you call the squad and you tell them it's not a heart attack. And then if it is, this doc here that we like so much, he's going to die in a hell of bullets.
You want to see what's on TV?
Saw the struggle from about 100 feet away. Yeah, Detective Walsh explained that he was out at that hour because he'd been having trouble sleeping. Yeah. Well, we're still putting it together, but at this point, it certainly looks that way. Looking to do the right thing. Point. Yeah, all right, Chief. Thank you.
Steve Graham, 27 Squad.
It's good to meet you, Steve.
You got my guy Walsh here?
Yeah, Mike's here.
Conscious?
Yeah, he's conscious.
How about telling me what went down without the lube job?
What do you mean, lube job, Steve?
I mean, out 4 o'clock in the morning, how Mike was. In my own experience with this ass, the 6 weeks I've had that squad, I figure him for drunk at the shooting and fighting off the DTs now.
Right now, it's looking like your guy came to a civilian's aid during his stick-up. He dropped one of the 2 perps and wounded the other. Unless it's material to that contact, I'm not real interested in Mike Walsh's story.
Of course. He's not hanging around your neck.
Your internal management problems with your squad aren't really any of my business either. That's correct.
Where you got him?
In the coffee room.
Busy night, huh, Mike?
Oh, yeah.
So how you feeling now?
Okay, you know.
I smell booze in this room.
They had a skeleton here a little while ago. Must be his leftover fumes.
Those shootings are coming up good, Lou. Everything they're coming up with, I was doing the right thing.
That's coming out of you.
Feel free.
He's one of the DOA perps running buddies. Has a ponytail.
Yeah, I want police. Yeah.
Mickey Rodriguez.
Yeah, here it is. Lists his mother's address off the collar 7 weeks ago. That might still be good.
Should we look to pick this Rodriguez up?
Gotta be vigilant finding a window to get a boss's permission to do actual police work off. They spend 80% of their shifts on a phone.
Man's in the 270 squad.
Family picnic once, my uncle was so short of breath he went blue. Well, we took him to the hospital and turned out that he was asthmatic.
Asthma can get you real short of breath.
Yeah, but how late in life can that come on?
I think what James is trying to say is that you can have it since youth, Andy, and not know.
You don't know it's asthma, but you know you got something. This, what Simone's got, is some sudden fresh onset. You don't get sudden asthma that late.
Then he puts a 22 slug in the victim and 238s in the perp.
The 238 matches Walsh's weapon. He only hit the perp.
We got maybe somebody we like for that perp's running, buddy.
The DOA perp had 6 collars. One of his accomplices had a ponytail. This Ricky Rodriguez was bailed out on a collar 7 weeks ago, listed his mom's address on the sheet.
Yeah, pick him up.
I've asked the police surgeon to come and evaluate Walsh.
Police surgeon?
Let's talk over here. Lieutenant, do you really want the borough chief knowing you brought the police surgeon over here? Raise the question of a cop's fitness and all the possible liabilities to the job that entails? Then have my investigation show that his condition wasn't germane and that he had behaved responsibly? Because I gotta tell you, Lieutenant, this is looking to shake out that Walsh's shots were good. The ME says that Walsh's bullets were only in the perp.
Every day. I got a period of time on my tour called the Walsh Hour, worrying how that guy's gonna screw me up.
So why don't you put the police surgeon on hold? Go back to your squad, stand by, and if Walsh turns out derelict or irresponsible, I'll call, and you can come crucify him.
I'll call off the police surgeon from downstairs.
So, go grab your guy up, and if there's any word on Bobby, I'll get a hold of you.
My mom's house like that. A good thing she had a loader.
How'd you hurt your arm? How did they hurt it?
Dark how it was, I won't say 100%, but I do think it's him.
No, I don't make it 100%. Because why make life easy at any point, right, Mike?
I'd sure like to step out for a meal or so forth.
Order something. We'll bring it in.
Says he found a rake. Wasn't garden till yet. Where were you gardening, Ricky? In that diner parking lot with your pal Miguel?
What's your big crop, Ricky? Wallets?
Oh, what are you doing? No exit wound, Ricky. That's making me feel that rake left a bullet in your arm.
I got an old bullet in my arm from a previous incident. This is a cagey guy.
You better hope that old bullet came from the gun shot you last night, Ricky.
Hey, halfwit. You were shot by a cop. Now, you keep giving no cooperation. I'll take that bullet out with a pair of tweezers right here in this room. I'll check the ballistics against the cop's weapon. And when it's a match, you will have 2 homicides staring you in the face from an incident that you were just standing lookout.
If you know he's standing lookout, how come you put me in the main event?
Ricky, are you willing to testify against Miguel?
Testify? Are you willing to at least give a statement on him? So Miguel's all right?
You throw this guy a chance to help himself, he sits with his thumb up his butt.
I mean, it looked like Miguel was dropped.
Why would we be talking to you if we weren't looking to put this on Miguel? Now, you are circling the bowl. You got 5 more seconds before we let you get sucked down.
I'll write a statement. But I will not testify at Miguel's trial.
Okay, it's a deal.
Hey, does it look like we're having an interview here? Huh?
From the 10th Avenue stroll. Said she heard we were looking. She got something to give on that shooting outside the diner.
She's gonna give it, huh?
Yeah, not exactly. Got some credit card collars she wants help with.
I know you.
Were we close?
You helped us with the 2 guys that murdered the son of one of our detectives.
Oh, yes. How is that, detective?
Anyways, let's talk about this incident outside the diner.
I got a problem of my own.
Yeah, I understand how it works.
Yeah, I'm up for, sentencing next week on the credit card misunderstanding.
If info's good, we'll reach out for you on that.
They'd authorized me using those cards, and later reneged.
I understand. Talk about the diner.
I'm not taking a beating for this involving a cop.
You might take one for running your mouth and never saying nothing.
Okay. Last night, this morning, whatever, I'm working those construction trailers over near the diner.
You're hooking in there.
I'm with a cop named Mike. Well, I'm not looking at jam coming forward.
No, this can do him nothing but good.
I mean, when Larry got in trouble, I didn't go running out to help. He could have kept on with his own business. This Mike.
Larry being Lawrence Sanders, presently dead?
I don't know his last name, but it was him got killed in that parking lot.
So Mike the cop hears trouble outside and goes and sees what's up?
Well, he trips and falls on his face, running out, pulling his pants up.
You were watching from where?
Out the trailer window. While Mike's running, Larry's struggling with a Latino, who I'm sure is one of the two greaseballs that's been taking off our tricks. 2 Latinos. Sorry.
Yeah, I'm okay.
Anyways, Larry gets dropped, and Latino 1 turns to shoot Mike.
Latino 1 as opposed to who?
As opposed to the second Latino, who comes from between the parked cars with another gun. Then after Mike drops the Latino that shot Larry, he takes 2 shots at this other one. And I think he winged him, which is pretty good aim for a drunk can't get a hard on. I mean, behind all that heroic behavior, I almost hate giving Mike up for whoring.
Yeah, so you didn't date her because you weren't attracted to her?
Susie, she was more of a tomboy type, you know? I mean, we were best friends.
So she
Now,
wasn't.
do you believe these people really don't know they're going to be reunited?
They look happy getting back together.
Okay, they're happy, but they have no idea that something's up. Hey, Dad.
How you feel?
My family.
I'm more comfortable.
Things never work right.
How's remotes to drive you crazy?
But if I'm going to be here, I have to go into detox when I get out.
Don't worry about the morphine. That morphine's part of helping your heart do its work.
We get some more results?
No real change in the second enzyme series. I'm still betting this is infectious. We'll follow you the next few days till your blood work gets back and eventually do an angiogram to rule out the heart attack definitively.
Okay.
The angiogram is not a very invasive test. We thread a little catheter in and take a direct look at the coronary arteries. You don't even have to go to sleep.
But you're still betting Bobby has an infection and that would be treatable.
Most of them are.
Good.
I wish I had more specific answers for you. We just have to take this one step at a time.
Okay. Thanks a lot, Doc.
If you want to eat here, instead of the cafeteria, the nurses can have an extra dinner delivered.
Thanks.
Just fill out a second menu at the desk.
Okay.
Thanks, Doc.
My uncle was a cop.
Oh, yeah? What borough?
Oh, not in the city. He was up in Boston.
My mother's father was a cop in Newton.
Just down the road. Anyways, I appreciate what you guys do out there.
Night, Doc.
I'm on call. Otherwise, I'll see you in the morning.
His uncle's on the job.
He's a really nice guy.
Nice guy. So you're gonna call squad?
I'll call in just a minute. I'll call when I go out to fill out my menu form.
Good.
You do feel more comfortable that way.
I am, yeah. If I'm gonna stay here, though, I wish these stupid guns would cover what they're supposed to cover.
Once again, the curse of the large privates.
That'll be the theme when this Jerry Springer guy comes on next. Order the Jello, even if you don't want it.
Okay.
Andy's always going for that black cloud scenario. That gets a little old for me sometimes.
Hey, James. Marie's first cousin. Enters the hospital with exactly Bobby's symptoms. Released 4 days later in perfect health after IV antibiotics. It just happens Andy's a worrier.
All I'm saying, for me personally, that negativity gets old.
What'd that horse say?
Walsh was banging her when the trouble started. Then he went outside to help.
You put any of that on paper?
You think you're the only cop in the squad that knows how to do this job, Andy?
What's your problem?
No, I didn't put it on paper. So as not to get Walsh in trouble.
See, that's the other side of Andy, though, James. Putting himself out, trying to keep this boss from hurting Walsh.
All I'm saying is I'm worried about Bobby, too.
Yeah, no question.
Second guy you hit's a collar and he gave it up.
So I come up right, Andy?
You got a whore put you banging her when this went down.
Oh, my God.
That's not going into fives.
Yeah? Because my boss gets hold of that. It's the river.
Let me speak my piece, Walsh. That's not going into fives. And my boss kept the police surgeon out of it.
Oh, believe me. Oh, I'm going to thank him. I mean, your entire squad.
I know what I'm saying now, because we're the same kind of drunk. You got no shot working and keeping drinking. Our cases are too advanced, and when something happens like outside that diner, we don't know enough to hide.
These shootings came up good, Andy.
Yeah, these came up good, and you still got a boss looking to hang you. And tomorrow night or the night after, when you go out and you got your load on, maybe the next...
Yeah, food for thought.
Hey, my partner's sick. You will or you won't.
Talking to Diane.
Is it an attack?
I'm inferring I don't think so.
Off what, Meadowboy?
Is he up to visitors?
It's cardiac unit, probably only family.
They're inclined to infection. Off the boss's half.
Not a heart attack.
That's my inference.
And they can cure that?
The boss is reacting positive.
You ever hear that attitude before?
Yeah, give him my prayers and good thoughts. Yeah, he's right here. I'll tell him.
Who's she talking about?
Yeah, take care, Diane. Well, Diane says the doctor thinks it's much more likely to be an infection than a heart attack.
Meaning what?
I'm telling you what she told me, Andy.
There's sore throats and bubonic plague. What nature infection is it?
It may take time until they know that.
Diane says it'll take about 3 days for the blood test to come back.
And what was that last part?
You know, just that, she and Bobby appreciated you bringing him over there.
She didn't want to talk to me?
Well, you figure she'd probably want to get back to Bobby.
Hey, I think we can all count our blessings, you know. Maybe Bobby's got, something like what my ex-wife's cousin had. You know, walks out with a clean bill of health.
Tell Diane she's welcome next time you and her chat.
Excuse me.
Hey, good for Bobby's the main point.
Where you going, Andy?
My club.
Because if you don't have to get home right away, Diane wants you to stop at the hospital, see Bobby and him, then take her home.
Let me look like half a jerk before you tell me?
No, I thought I'd take into account other people not being asked. And they might have feelings, too.
Yeah, well, that's a point.
I'm very grateful. It's a stand-up squad.
Good luck to you, Walsh.
You're a stand-up guy, Andy.
I'm also frequently a pain in the balls.
Yummy.
Off the regular menu, too.
Oh, the jello's good.
We can always count on Jello.
Are you all right?
Yeah.
Oh, he says he doesn't feel bad. One of your leads came off.
If you don't come in with heart problems, this alarm will give you an even shot, huh?
Isn't it awful? Andy.
Hey, how's it going?
Just left the alarm off.
I used to do that in any building. I'd go over to the second floor.
How'd the Walsh come out?
Hey, he's all right with the shooting. Overall outcome, that's an open question. So, they think this is some type of infection?
Hey, they're gonna run some more tests to try to figure out what kind of medicine to give me.
But you're feeling a little better.
I'm feeling more comfortable, yeah.
And the president's Staffel International.
That lying phony. Here's a guy, got over like that on your daughter, you give him the beating of his life. We got him running the country.
Andy Rooney.
Yeah, he should get half a smack through that cocky Andy Rooney.
I've got your nighttime meds.
Okay.
Ring, shaving stuff, slippers tomorrow morning. What else?
Just you. Anything else is a bonus. Sleep tight, babe. You sleep tight, too?
Yeah. Take care.
This is the Lasix for your heart, and I've also got something to help you sleep.
Oh, let's see if maybe I sleep on my own, okay?
I have to give you the Lasix, though. That's to help your heart.
Yeah, I understand.
Do you think he looked better than this morning?
Said he's definitely more comfortable. Liable to come out as better than no.